Hello, my name's Luke Pollard. I'm the Member of Parliament in Plymouth, Sutton and Devonport, and earlier this year I had surgery to remove skin cancer from my face. I was diagnosed at the end of last year and had the surgery at Easter this year. The scar is healing really well across my face, but it knocks my energy levels down quite a lot. But I'm really pleased that it is healing. You can notice it if you look, and it's got a lot better. But for me, this is an important part of who I am now, and the scar is not something that I'm scared of, which I thought I would be at the start. It's something that follows me around everywhere I go, can't really escape it. And now it means that every time I look in the mirror, I can remember that I helped beat cancer right there. I had a bump on my arm. In fact, I still have a bump on my arm, and my other half said, "You've got to go and get that checked out." And I was like, yeah, of course I will. And after a little bit of persistent nagging, I managed to get a GP appointment to follow his advice. And when I was there, the GP said, "That's fine. However, that on your face, we do need to get checked out." And it was because someone who cared about me insisted that I go get checked out that I started that journey to have my skin cancer diagnosed. And once they had spotted it on my face, had a biopsy right in the middle of of what looked like just like a spot, and I'd had a spot there for some time, and I thought, well, I used to have spots quite a lot when I was younger. I still do occasionally. I thought it's just another spot that hasn't gone away, and it turns out that the biopsy identified it as skin cancer, not a spot. And at that point I had the options as to what to do with it, whether to have an operation, whether to have radiotherapy or other options, or leave it. And I took the medical advice that I received and had an operation, and then they cut a big hole in my face. And if you look very carefully, you'll be able to see that this side of my face is a little bit more floppy than this one, because they had to pull the skin on this side over to fill the hole, which is why I have a scar like this when they sewed me back together. From the moment you're diagnosed, you think the worst. And I certainly did, and certainly some of my friends and family did. So getting from the diagnosis to the treatment is really important, and that happened relatively quickly within the target time frame, and then straight onto the operating table for the operation only after a couple of months. I think I owe the NHS a huge debt of gratitude. The staff, from the moment I was diagnosed with my GP to the folks that look after me in hospital, have just been superb. They've been warm, generous and professional, and very reassuring. And I think when you're going through treatment for cancer, you do think the worst. You do worry about what's going to happen to you, and especially when you're having an operation on your face. For someone who's in the public eye, I have to spend a lot of my time making speeches in front of people, being filmed. I was very worried about what the consequences of having an operation on my face would look like. And I have to say the staff have just been so incredibly kind, professional, and given good advice throughout, and it's another good reason why the NHS is one of Britain's best inventions. Immediately after the operation, I had I wouldn't say a big plaster, but it was a big bandage right across my face. I had a black eye from the amount of tussle in terms of the operation, and that took a while to go down. But I had good advice to basically lie down and recover and do nothing else. Immediately after I had this operation, I had to effectively be on my own to reduce the infection risk. And as someone who likes to pride myself on being an Energizer bunny, doing nothing wasn't the easiest thing, but following that advice was exactly the right thing to do, because that allowed my body time to heal, time to understand the shock of having an operation, and then got me back on track. Taking it easy after an operation is not always easy for folks. I struggled a little bit along the way, but I'd encourage you to follow the advice. Heal up and look after yourself, and that means for me drinking plenty of water, staying hydrated, making sure that I'm wearing sunblock at all times and reapplying it throughout the day, and then making sure that I'm moisturising the scar to help it go down, and importantly looking out for any other bumps that I might have on my body that could also signify that there's skin cancer anywhere else, and if there is, get it checked out as soon as I can. think we all think we're invincible, and it turns out that we're not. If you have a bump or a lump that you're worried about, or someone that close to you is worried about, get it checked out. If I hadn't been nagged by my boyfriend, I probably wouldn't have gone to the GP to have that bump checked out, which probably meant I wouldn't have had my skin cancer spotted. So if you are worried, don't worry about it in silence. Your GP wants to see you. The people in the NHS want to see you. I know that we're all worried about the NHS at the moment. We hear on the news about difficulties within our health service, but it is precisely this that we have a health service for, precisely this that we have NHS staff who want to help diagnose and treat people, because the sooner you get any cancer diagnosed, the sooner it can be treated, and most importantly, the better the outcome will be. Now, the skin cancer survival rate is incredibly high if caught early, and that's really important. And I hope that I'll be able to keep causing trouble in my job for many years to come because of the treatment that I've had. But the earlier you get seen, the earlier you can have certainty about what that bump or lump is, and the certainty about what will happen if it is cancer at the end. So I've been lucky. I've had my cancer caught early, and I've been able to have it treated quickly and professionally by the NHS. If you're worried about any lumps or bumps anywhere on your body, please get it checked out. And remember, wherever you are, please wear sunblock, not just in the summer, but right throughout the year. That's the best way to look after your skin, to make sure that you are helping reduce the chances of skin cancer happening to you. So after I had my surgery, I was told to look after myself and not see anyone for about 5 days. That was to reduce the infection risk. After you've had surgery, after your body's been opened up, it's always good to look after yourself. It took my body a wee while to recover after that, and although the advice will be individual to you and the type of operation that you've had, it took me a couple of weeks longer to have the energy levels built back up so I could start to return to work. I returned to work part-time, and that wasn't because of the scar on my face or the bandage on my face. That was because I didn't have the energy after the operation to feel able to do a full day's work. I now have had my energy restored and I'm back to work full-time, but it's worth being kind to yourself. When you've had a big operation, there's always temptation to get back to work as soon as you can. The worry about, oh, that work that's not being done, or the pressure that your absence may put on other team members. Be kind to yourself. And once you feel ready to go back to work, take that extra day just to be certain. That's what I did this time round. Very rare that I actually take my advice on this type of stuff, but it made a really big difference to my recovery, to feeling able to be back at work, and to be confident that I'm doing something that actually helps my recovery rather than makes it harder. You will be your own worst enemy when it comes to a lump or bump. You will either think the worst of it or not want to deal with it at all. It is worth knowing, because the peace of mind that comes from knowing that there is a treatment option, that there's help and support available, is it's absolutely worth it. So if there is a lump or bump on you anywhere, please go to your GP, get it checked out. Dr. Google is not the best place to find advice about lumps and bumps. Your medical professional has trained for years to be able to identify correctly and to be able to diagnose and refer you on to further tests and treatment if necessary. So please get yourself to a GP, get yourself checked out. That is precisely why they're there, and they want to see you. You are not being a burden on the health service. You are doing precisely what they want you to do. And the sooner you can get any lump or bump checked out, the more effective the treatment will be and the better the outcome for yourself. So don't sit at home worrying. Call your GP, get it checked out. Thanks very much. Oh, and don't forget about the sunblock.